And good evening. I'm County Supervisor Joe Simidian. Let me turn it over to Cupertino Mayor Darcy Paul to kick us off.
Thanks, Supervisor. Good evening, everyone. I'm Cupertino Mayor Darcy Paul. Thank you all for being here and participating in tonight's vaccine town hall. I want to extend my appreciation to Supervisor Joe Simidian, who in his decades of elected public service, having effectively and thoughtfully represented us on the county and state levels, is currently in his 9th consecutive year representing our district, the 5th district on the County Board of Supervisors. Thank you, Supervisor Simidian, for partnering with the City of Cupertino to host this locally focused event. On behalf of the City of Cupertino and our City Council, we are pleased to work with Supervisor Simidian and the county to put forth this critically important event. The purpose of tonight's town hall is to answer the question of when, where, and how residents can get their COVID-19 vaccines. Without further ado, let me bring you back to County Supervisor Simidian and tonight's esteemed guests. Thank you very much.
Thank you. Thank you very much, Mayor Darcy Paul. Very kind of you. And thank you all for being here this evening. As the mayor said, I'm County Supervisor Joe Simidian. I represent what is known as the 5th Supervisorial District. For most folks, that doesn't mean an awful lot. So let me just say it is about 400,000 folks in the north and west of our county, in all or part of 8 different cities, including all of Cupertino. So thank you so much for joining us. We are going to try and focus exactly as the mayor said on when, where, and how you all can get the vaccine. And in addition to my role representing Cupertino and all or part of 7 other cities here in Santa Clara County, I have the privilege of serving as chair of the county's Health and Hospital Committee. So these COVID issues, of course, have been top of the to-do list for me and my office and for a whole lot of folks, obviously, over the course of the past year. We're going to keep pushing on the very basic question. And as I tell everyone, these are the questions I get from the folks I represent on a regular basis after we have the wider ranging discussion. They all say, all right, but the most important thing is when, where, and how do I get the vaccine? So that's what we're going to talk about tonight. And we're trying to have these conversations on a regular basis so that we can bring you accurate, up-to-date information that is timely as of tonight. But I want to underscore that we may quite literally have new information tomorrow. This has been an ever-changing set of directives from the state, and we do our best to keep up and to share that information with you. But what we share with you tonight will be literally up to the minute. We've got folks who have been pulling information together during the course of the day that they can share with you. Joining us tonight, we've got folks who can represent the county's health and hospital system and public health department. We've got folks from our county counsel's office. That's our legal counsel to help us respond to some of the legal questions along the way. And there are a surprisingly large number of them. And perhaps of most direct interest to everyone will be our local healthcare providers answering that series of when, where, and how questions about how you access the vaccine. And we're going to try and make sure that we answer that set of questions for you, no matter who you are, where you are, what your set of circumstances might be. Want to make sure we get to that. So some of you were kind enough to submit questions in advance. Thank you. Thank you both, because we'll have the questions and we'll get to as many as we can, but also because it gives us a sense of what people are interested in. The other thing I would say is that if you have questions tonight, we want to try and take those. We'll probably use the last half of our hour together to take those questions. If you have a question, just go down to that Q&A function right there at the bottom of the screen. And I see somebody's already found it. So that's where the questions go. Please do not use the raise your hand function. That's not the right way for tonight's program to get your questions into the queue. Just go to that Q&A function and we will do our best to get to as many questions as we can. If we have enough questions, we'll run a little long if need be to get to them, but no later than 7:45. And so let's just begin with sort of an assessment or an update as to where we are today. And again, I'm going to keep emphasizing this. What you learn tonight may or may not be accurate tomorrow, the day after, or next week. So please stay tuned to whatever your best sources are. We hope this is one of them. And I think it might be helpful to start with somebody from our county counsel's office. That's our legal counsel. We have Mr. Aaron Bloom from our county counsel's office with us. I'm going to ask him to just very briefly outline how the vaccine gets from a manufacturer directly to your arm, my arm here in Santa Clara County. So, Mr. Bloom, if you could take it away there, we would appreciate it. And I see the mayor popping. There he is. I was going to say, I see the mayor popping up on my screen. I don't think he wants that assignment. So we'll turn to Mr. Bloom and let you handle that brief description as folks put their questions in the Q&A function down at the bottom. Mr. Bloom, thanks so much.
Thank you, Supervisor. So I'll provide a very high-level summary of, just as the Supervisor Simidian said, how vaccines come from the manufacturer and ultimately end up in our county and in folks' arms. So right now, there are 2 vaccines that have been approved. That's the Pfizer and the Moderna vaccine. Hopefully, the Johnson & Johnson vaccine will be joining that shortly and adding to our supply. The way that the vaccines are distributed is the federal government distributes the vaccines as sort of the high-level distributor. It directly distributes the vaccines to a few different sources. So first, to certain federal departments relevant for our county, the Department of Veterans Affairs and the VA hospital system, as well as the Indian Health Authority, directly receive vaccines from the federal government, as well as certain of the federal partnerships. So both with the CVS and Walgreens partnership, where the federal government has partnered with CVS and Walgreens to help vaccinate the long-term care facilities in our county. And then finally, also with certain of the mass vaccination sites. And the one in the Bay Area that is of most relevance is the mass vaccination site at the Oakland Coliseum. The biggest way then that the vaccines come to us is then the federal government allocates a significant amount of vaccines on a weekly basis to states. And so in California, vaccines are allocated to California, and then California decides how to allocate those vaccines within California, including to our county. And the way that California does it right now, although I will again stress with this point that Supervisor Simidian made, that this is all subject to significant change and is going to change significantly in the next few weeks. But right now, the state directly allocates vaccines to multi-county entities. And in our county, and you'll hear from tonight, Kaiser and Palo Alto Medical Foundation / Sutter, and then also allocates vaccines to the county health system, which then in turn distributes those vaccines both to the county health system itself and then to other providers such as Stanford, El Camino, and smaller community clinics as well. And so then ultimately those providers, that being Kaiser, Palo Alto Medical Foundation, the county health system, Stanford, El Camino, and certain community clinics, then operate their own vaccination sites, and folks can go to those vaccination sites in order to receive their vaccine. The final big item, or 2 big items I want to note, the state also decides who's eligible to receive a vaccine. And so right now, what the state has said, although I'm going to stress that this is also subject to change, is the following categories of people are eligible as supplies allow. And I want to stress that part because it is relevant, and as you'll hear from certain of the providers, there's been some limited supply, which has impacted this. But as supplies allow, the following individuals are eligible: healthcare workers, long-term care facility residents, people age 65 and above, and then those at risk of occupational exposure to COVID-19 in 3 sectors. And that's the emergency services sector, education and childcare sector, and the food and agriculture sector. And so if you are one of those individuals who qualifies in those groupings, and the provider has sufficient supply in order to vaccinate all of those, then those are the people who would currently be eligible to receive their vaccine. And then the final point I'll just make is that in the next couple weeks, we know that this system is going to change fairly significantly on the state level. The state has selected a third-party administrator, Blue Shield, that will be taking over the function of directly distributing vaccine to providers. And so I think you'll probably hear a little bit this evening that to expect some changes in the next few weeks to that. I think from an end user standpoint, you'll still be going to a variety of vaccination clinics in order to receive your vaccine, but it will be a little bit of a different distribution system. And I'll stop there for now in order to make sure there's sufficient time for all of our providers.
And thank you very much, Mr. Bloom. And let me just, I can't help but point out that Mr. Bloom had not one, not two, but three pieces of somewhat discouraging news to share, and that was his duty. The fact that, as I said earlier, the information will change, and so that's a frustration we all share, I think. The fact that all of this is dependent on the vaccine availability, and I suspect that'll be a theme you'll hear tonight, which is none of the providers are in charge of how much vaccine they receive. So everything they say will be dependent on the availability of vaccine and the supply that they're given down through the state system. And the third thing is that all of this may be very significantly changed within the next 2 or 3 weeks, because the state has decided to try a new approach with what they call a third-party administrator using Blue Shield. So we've got continuing uncertainty. We've got shortage of supply that continues, at least at the moment, and we've got a change in the system coming shortly. All of these are challenges we'll just work our way through because we have to. But in the meantime, let me say that it's helpful to focus on when, where, and how you can get the vaccine under the current system. And so among the providers we have is Kaiser Permanente, because the folks at Kaiser, along with the folks at Sutter / Palo Alto Medical Foundation, taken together, those two organizations probably have the responsibility for roughly half the patients in our county. So let me go to, I know we have both Eric Williams, who's the interim Senior Vice President and Area Manager for Kaiser Permanente. We also have Dr. Rakesh Chaudhry, who is here, who's the Physician in Chief. And I think we're going to start with Mr. Williams and see what he can share with us about the when, where, and how of how Kaiser patients and others, as you'll hear, can access the vaccine. Mr. Williams, thanks so much. What should we know?
Hey, good afternoon. Good evening. Thanks so much, Supervisor Simidian, for inviting us to speak with you this evening, and thanks for the invitation. As mentioned, my name is Eric Williams. I'm the interim Senior Vice President Area Manager for the Santa Clara Service Area, and I'm very excited to be here today to share some details about our vaccination efforts at Kaiser Permanente. We at Kaiser Permanente are committed to getting COVID-19 vaccine to our members and to the community as quickly and as equitably as possible. We have vaccine appointments available for eligible healthcare personnel in the 1A tier and to those individuals who are 65 and older. For locations, we have 2 vaccination sites located at Kaiser Permanente Santa Clara and San Jose facilities. At Kaiser Santa Clara, our vaccine clinic is located in our medical office building in the Homestead Conference Room. Our hours of operations are Monday through Thursday, 7 a.m. to 7 p.m., Friday, 7 a.m. to 5 p.m., and Saturday and Sunday from 7 a.m. to 3 p.m. In the upcoming weeks, we plan to expand our operations to our outdoor site on the Santa Clara campus. For Kaiser San Jose, the vaccination clinic is located in the medical office building in Building 1. The hours of operation are 9 a.m. to 5 p.m., 7 days a week. And they have just recently opened an outdoor parking lot site with the same hours operation on their campus. There are 2 ways to schedule an appointment with Kaiser Permanente. The first is by scheduling online through our MyDoctor, kppermanente.org, or through kp.org/COVID vaccines. The other way is to call our appointment and advice call center line to speak with a representative directly at 1-866-454-8855. Thank you very much, Supervisor Simidian.
Thanks, Mr. Williams. And I'm going to just highlight a couple of points and put you on the spot a little bit if I can. The first is I noticed that the slide has literally changed from one day to the next for Kaiser. We previously were aware of the fact that shortages of the vaccine meant you could only advertise the vaccine availability for folks 75 years of age or older, but I noticed that the slide tonight says 65. What can you tell us about that? Can I just underscore that folks now who are 65 or older can in fact reach out and make an appointment through Kaiser?
Thank you, Supervisor. Yes, we're delighted that the supply has now increased over the last week or so. We're now able to offer it to 65 years of age and older.
And Mr. Williams, we have had a change in the last few weeks that I think is a good one. It was one that I was pleased about, which is we now have something called a no wrong door policy in Santa Clara County, meaning that folks who are trying to get access to the vaccine can go to their regular healthcare provider, but they can also go elsewhere. So does that mean that even if someone is not a Kaiser member, they are eligible, able, allowed to come to Kaiser and get the vaccine if that turns out to be the easiest, best way for them to get the vaccine?
That is correct, Supervisor.
All right, that's a great answer, Mr. Williams. Thank you. I appreciate that. So, all right, so in all seriousness, two important things. 65 and older now, and that no wrong door policy for those who are hearing about it tonight for the first time means that if you cannot get the vaccine on a timely or readily accessible basis from your regular provider, you can go to another provider. So if you're a Sutter patient, you can go to Kaiser. If you're a Kaiser patient, you can go to Sutter. If you're an El Camino patient, you could go to Stanford. If you're a Stanford patient, you can go to El Camino. And all of the above can go to the county. So the hope and expectation is that this will make it possible eventually for everyone to find their way to a readily accessible site. So let me say thank you to you, Mr. Williams. And I know we have Dr. Chaudhry standing by in case there are questions as we go through the conversation tonight. So my thanks to you both and to the folks at Kaiser. Let me then see, I think we have a slide from the folks at Palo Alto Medical Foundation Sutter. Here it is. The folks at Palo Alto Medical Foundation were not able to join us tonight, but they did provide the same basic information that folks will need. And again, as you see here, they are working on the 65 years of age or older criteria that you already heard. And this comes largely from the state. They have sites, as you can see, at Mountain View and Palo Alto and Los Gatos clinics, and a larger site that will be coming soon. And again, you can schedule an appointment by phone or book online. For folks who are receiving their healthcare regularly at Palo Alto Medical Foundation, you probably have a My Health Online account. You can go there and attempt to schedule there. If you don't have a My Health Online account or aren't regularly getting your healthcare at Palo Alto Medical Foundation, the phone may be the easiest option for you. And I'll just say, one person's personal experience. I typically get my healthcare from Palo Alto Medical Foundation. Went online, could not find an appointment available. So I just said, well, let's try the phone, and picked the phone, called, had a brief wait, maybe 10, 15 minutes at most. That was what I was told to expect when I called, and I was able to work with a very professional person at the other end of the line who set me up for an appointment coming up in a few weeks now. So that system worked for me, but had it not worked for some reason, I could have gone to one of these other providers, and under the no wrong door policy, if you're not regularly with Palo Alto Medical Foundation, that does not preclude you from going to the foundation for your vaccine. So let me say thanks to the folks from Palo Alto Medical Foundation for that information. And so now let me turn to Lisa Schilling of Stanford Healthcare, who will fill us in on how their operation works and when, where, and how you can get the vaccine.
Yeah, thank you, Supervisor Simidian, and thank you, Mayor Paul, for inviting us to this community conversation. At Stanford, our goal is to ensure that Santa Clara County residents can easily access vaccines and navigate the process. So what we've done is we first will open up appointments, as you can see, to follow the county guidelines around who is eligible. So that's today, healthcare workers and all individuals age 65 plus. And as of the 28th of this month, the appropriately qualified workers in education, childcare, emergency services, and food and agriculture. We have 3 sites in Santa Clara County that you see here, and access over the weekends, particularly at Arriaga Gym, but also Monday through Friday at the other 2 sites. There are two ways to book appointments. One is by going online and enrolling in My Health and setting up an account to get the appointment and choose your availability. Or if you choose, you can call this phone line 8 a.m. to 5 p.m. 5 days a week. For anybody who has a need for translation services, the phone is probably the appropriate service. We have many translate for folks who need that support. So I'll stop there and allow you to keep moving with questions.
Thank you, Ms. Schilling. And Ms. Schilling, I should have mentioned, is the VP for Quality, Safety, and Clinical Effectiveness at the Stanford Healthcare System. She's a registered nurse as well. And Ms. Schilling, I will keep pushing this point. Stanford is also part of the No Wrong Door policy and program. And so if folks are not regularly your patients, they can still access the vaccine by coming to Stanford Healthcare, yes?
Absolutely. We're here to serve the community, so we offer appointments for anyone who lives in Santa Clara County.
Thank you so much. And it's at this point in the conversation that typically folks are starting to say, how do I keep track of all this information? How do I scribble down these phone numbers and online addresses as quickly as need be? And let me give you just two quick pieces of information, everybody. The first is, if you'd like to listen to any or all of this presentation again, it will be up on my website, supervisorsimidian.org, supervisorsimidian.org, within the next 24 hours or so. And you can access it there and find the information that you're looking for. But the thing I want to make sure is that if you remember nothing else from tonight's conversation, please remember this address online, sccfreevax.org. That's SCC, short for Santa Clara County, sccfreevax.org, because if you go to that site, it will give you easy access to all of the providers that you're hearing from tonight. It's sort of a one-stop shop. And if you go to your provider, you'll be connected right away. You'll have access to their online address. You'll have access to their phone number. If that doesn't work for you, you can go back to sccfreevax.org and look for help from another provider. It really is the sort of quickest, easiest way to make sure you get the information right. And I use it regularly, and I hear good things from others who use it as well. So thank you again to Lisa Schilling from Stanford Healthcare. And let me ask now that we move on to Dr. Malur, who is the Associate Chief Medical Officer at El Camino Health. And Dr. Malur is going to let us know what the when, where, and how is at El Camino Health. Dr. Malur, thanks for being with us again.
Thank you, Supervisor Simidian, and thank you, Mayor Darcy. So El Camino Health is, as all the other organizations, is committed to getting vaccines into arms, and the big limiting factor is obviously vaccine supply. However, we are scheduling vaccination appointments for healthcare workers as everybody else, according to county guidelines within Phase 1A. All county residents 65 years of age and older, and starting, on the 28th, workers in education, childcare, food and agriculture, and emergency services. Obviously, this also is dependent on vaccine supply. A couple of things I wanted to highlight was the question of where. We have one site in North San Jose. It's near the 237 and 880 freeways. When you click on the site, the address will come up. The other thing that El Camino is working on is on a mass vaccination site, which we hope will go live pretty soon in the next couple of weeks. This will be within the El Camino Healthcare District, which consists of Mountain View, Sunnyvale, Los Altos Hills, and Cupertino, parts of Cupertino. So that should be pretty close to Cupertino folks' residents. It'll be in North Sunnyvale, should be a couple of exits off of from 85. Appointments will be Monday through Saturday, 8 a.m. to 4:10 p.m. And we also have a phone line open with translation services, which would be ideal for people who don't have internet access, or as Michelle was also saying, for people who have difficulty if they need a translator. The number is up there on the screen, 408-871-76 7460, Monday through Friday. And you can also book online, alcaminohealth.org, schedule vaccine. As Supervisor Simitian was saying, we follow the no wrong door policy. We try not to waste any vaccine. So we actually have a standby appointment. We have standby appointments. There's a link on the website where you can sign up for a standby appointment. And when that pops up, you'll be put on standby. So we try not to wait a single dose of vaccine. And as everyone is saying, it's all dependent on the vaccine supply. And El Camino is ready, willing, and able. As we get more vaccine, we will get them into the arms of our folks.
Thank you so much, Dr. Miller. A couple things I want to highlight before I let you slip away a bit, and that is on this El Camino Health slide, folks will notice that workers in education and childcare, food and agriculture, and emergency services are highlighted as having access to the vaccine beginning on the 28th, coming up in just a few days. And that means that a whole host of folks are suddenly going to be accessing available appointments. So if you are someone who isn't on that list of categories, but have been identified as eligible by virtue of your age, meaning 65 years or older, I really want to encourage you to get yourself an appointment as soon as you possibly can, because I think while there will be additional vaccine coming, and we hope that number will go up each week, we know to a certainty that a dramatically greater number of folks are going to be eligible and seeking out appointments. So if you're in that 65 of age and older category and haven't yet accessed an appointment, I strongly encourage you to do that. And then, Dr. Miller, you were a little bit cryptic, so I'm going to try and pull this information out of you, if I may. That mass vaccination site that's coming soon, if I remember correctly, it is expected to be pretty much on the border of South Mountain View, North Sunnyvale. Am I remembering that correctly?
That is correct. That is correct.
All right.
Yes.
So I don't want to give away too much, but I think that'll help folks who are watching tonight identify whether that's a convenient location. And I think you also indicated that we are expecting that site's going to be very convenient just off Highway 85 for folks who can hop on to 85 and literally just make a few exits down the highway. Did I get that part right as well?
That is correct. It should be off the freeway, and the exact address, once we sign the dotted line with all the contractual and legal stuff, we will release the where exactly it is.
No, thanks very much, and thanks to your organization for standing up that effort. I think that's going to be a marvelous addition to the effort. So that now allows me to say, let's go to our own Dr. Jeff Smith from Santa Clara County. Dr. Smith is our CEO, our county executive here at the county, which means he's responsible for the 20,000 person organization that is Santa Clara County government. But fortunately, in this instance, he's also trained and has practiced as a physician. So he has his arms around the medical side of this, as well as the logistical and financial challenges. And I want to ask him to give us an update on the county vaccination sites and the hospitals and clinics and how folks can access those services as well. As Mr. Bloom mentioned to us earlier, the county currently is playing a dual role, which is some of the vaccine that comes from the state of California goes to folks who are typically patients of the county's health and hospital system, but the rest of that vaccine goes to folks who are not typically patients of the county's health and hospital system, either through this new network of distribution sites or by sharing the vaccine with folks like Stanford, like El Camino, who have not been getting direct allocations from the state. So why don't I turn it over to you, Dr. Smith, and let you walk us through the information here and whatever else you would like to share. And you can count on me to emphasize scfreevax.org down there at the bottom of the screen. Go to it.
Thank you, Supervisor Simidian, and thank you, Mayor Paul, for inviting us to this forum. The County of Santa Clara is responsible for the second largest health system in the state, public health system, I should say, in the state. And as such, we are responsible for 3 hospitals and 8 different clinics within the county borders. We have multiple vaccination sites, and right now our criteria are the same that you've heard before. Anybody who's a healthcare worker or a long-term care facility resident or who is 65 years or older is eligible right now. And starting in 3 days, anybody who's involved in the education and childcare field and at risk, as was brought up by Aaron, also in the food and agricultural field at risk, and in the emergency services field at risk, is eligible for vaccination. We have 2 sites that are the closest to Cupertino. One is the Mountain View Community Center. One is the Santa Clara County or Santa Clara City Levi Stadium. We also have multiple sites in San Jose and Gilroy that are also accessible. In order to make an appointment in our system, go to stcfreevax.org. You can see the link down there at the bottom of the slide. At that website, you'll be able to look at all of the other links that you've just been talking about with all the other health systems as well, but there is a link for the county health system. You'll be able to click on that link, document that you qualify, find an appointment at a site that is appropriate for you, book the appointment at that time. The other option, if you're not interested in going on the web, is you can call the phone number 408-970-2000. You'll talk to somebody who can speak to you in 5 major languages and schedule an appointment for you. Also on the stcfreevax.org site, you can see all the directives and recommendations from the state, from the local public health order, and information about vaccine and COVID. And you'll also be able to, as I said, schedule an appointment. Thank you.
Thank you, Dr. Smith. And again, even though you've just spelled it out, I do want to direct people to that stcfreevax.org. If you haven't visited there, it really is, in my experience, the quickest and easiest way to get yourself to the right place. A reminder that the phone lines for all of these folks will be somewhat dependent on what time of day you call. So you'll want to make sure you're calling during the hours of access for the particular provider if you're using their phone line. And again, the county stands ready, willing, and able, pending vaccine supply, to accommodate folks regardless of who their quote regular healthcare provider might be. And I was just out at the Mountain View site within the last couple of days, and it was really something to see. Probably 800 folks a day getting their vaccine at just that one site, very well organized, and obviously with all healthcare precautions top of mind. So, having heard from the different providers now, I would like to take questions to the extent that time permits, and we're going to start with questions that are in the system now in our Q&A function. If you have questions and would like to ask them, please go to that Q&A box down there at the bottom of the screen, and we will take as many as we possibly can. And let's see, who is up first? Well, as I'm trying to access the question, there we go. But I know we have a couple of questions that were frequently asked questions, FAQs that came in earlier. So let me just ask, both Ramila and Joseph had questions related to trying to get a better understanding of when people under the age of 65 with other health conditions will be able to be vaccinated. So let me ask Mr. Bloom or Dr. Smith, how about folks who are not yet 65, but who have other health conditions? When are they going to be able to be vaccinated? It's a common question.
Yeah, so I think we can give a partial answer to that question, which will be satisfying for some folks, but perhaps not as satisfying for others. And unfortunately, we're just waiting on that information from the state. But let me give the partial answer first, which is starting March 15th, healthcare providers can use their clinical judgment to vaccinate individuals 16 to 64 deemed at the very highest risk of morbidity and mortality from COVID-19. And there's a list of severe health conditions that the state has put out that would count for that, that include, for example, chronic kidney disease above a certain stage, chronic pulmonary disease, Down syndrome, pregnancy, certain heart conditions. And then as well, if there's a developmental or other severe high-risk disability with certain criteria, folks would be eligible as well starting March 15th. So I think that's the portion that we do know. And then I think on the rest of folks, we're just waiting to hear from the state. They've sort of stopped at the end of these sectors, which are, as you'll hear, pretty expansive: the education and childcare, food and ag, and emergency services, and then those very high risk conditions. And then we're looking to see more guidance from the state as to who will be after those.
All right, thank you. Dr. Smith, anything to add to that, or does that pretty much cover it?
No, that pretty much covers it. Thank you.
All right. And we also had a question from Nora, who asked about the safety of receiving the vaccine. Nora in particular asked, what about the safety of receiving the vaccine if you've not had COVID this past year? Let me turn to either Dr. Chaudhry or Dr. Mallour if they would care to comment on the safety assessment on the vaccines that are approved for use right now.
Yeah, thanks, Supervisor Simidian. I can take a first stab at it, and then Dr. Mallour can fill in the gaps that I leave. An extremely effective vaccine. We've never seen a vaccine this effective from Pfizer and Moderna. This mRNA vaccine is very, very effective and extremely safe. I think the question, I saw a question in the Q&A, what about somebody who has died subsequent to the vaccine? Really, the potentially fatal side effect of the vaccine happens within minutes if it's going to happen. And we are ready for that, and that's anaphylaxis. And that's a severe allergic reaction that's immediate, that can frankly occur with any vaccine, but it's been reportable out there of occurring. We have nurses and doctors in our observation area to look for that potential side effect. Again, that's why we have people wait for 15 minutes at least in the observation area. It's to look for that particular side effect. And it's easily treatable. You give epinephrine and you get somebody to a hospital. So there's that, and that's a very, very rare side effect. I don't know what the most recent numbers are, but they keep going down. It seems like the longer we have the vaccine, we're realizing that it's looking safer and safer with time.
Thank you for that. Dr. Mallour, anything else you'd like to add?
No, Dr. Chaudhry said it very well. Very safe, very effective vaccine. And yeah, the only other side effects that you see are these, fevers, fever and chills and that sort of thing. But that's the reason, because we have folks wait for 15 minutes exactly for the reason of anaphylaxis, and we are ready to deal with it, and we have doctors and nurses there.
Thank you both. And just the only point I would underscore as someone who is not a medical professional is I do hear a little grousing occasionally from people who want to get their shot and be on their way. And I think it's important to underscore what we heard from both doctors, which is that as rare as any adverse reaction might be, that's why folks need to just sit tight for 15 minutes and take that extra precautionary step. Let folks observe you and make sure that if there is that very rare occurrence, they can step in right away. Patricia, I hope that answers your question as well. That's the first question that was up that the doctor referred to. We do have a question as well from somebody who says, all right, when will the 50 to 64 age group be eligible? And presumably this is folks who are not in the category of having other medical conditions. So do we have any sense from folks at the state about when the age limit might be reduced from 65 down to 50 to 64? Dr. Smith, I see your mic is on.
We don't know the answer to that question right now. The state started off with naming sectors, specifically healthcare workers, and now has moved into age groups, and now back again to sectors, business sectors. We don't know if they'll continue with business sectors or if they'll transition back to age groups for those individuals that are otherwise healthy. So as soon as we know, we'll let everyone know.
All right. And for those who are on the call and who are occasionally disappointed by these answers, as I know we sometimes are, I just want to point out we've got 3 or 4 doctors and nurses from 4 or 5 different organizations. We've got a mayor, we've got a county supervisor, we've got a county executive, we've got a lawyer from our county counsel's office. And so when they tell you we just don't know yet, it's not because every one of these people hasn't been pushing to get the information, but it should be some indication of just how tough it is to get good answers to some of these questions, in spite of the fact that we would all like to know. Let me go to Vijaya's question, and I hope I'm getting the name pronunciation right. My apologies if not, Vijaya. Vijaya says, I need to travel internationally for family obligations. Will there be any preference to get the vaccine? Any preference, Mr. Bloom, Dr. Smith, for folks who are traveling internationally?
Not so far. I mean, again, I think we'll have to see what the state does in the future, but right now the categories are sort of as we described. It's the healthcare workers, long-term care facility residents, 65 and above, and then those 3 work sectors, the education, childcare, food and ag, and emergency services.
All right, we've got a questioner who says, hey, the state announced approximately 2 weeks ago that there would be a change March 15th for those under 65 with pre-existing conditions. And of course, we talked about that earlier, based on a published list and then those folks would be eligible for the vaccine. The state said they were announcing early so that providers could publish how those with these conditions could get proof of their approved condition in order to get a vaccine appointment. But since then, the program participant says, we've not seen anything on either the Santa Clara County site or the provider sites or from the state about how proof can be provided. Who can tell all of our listeners tonight, if you're in that category, that folks who are looking forward to March 15th in terms of their eligibility, what kind of proof are you expecting, requiring? Anyone who would like to weigh in on this, please feel free to do so. Just lean right in. All right, that should tell us something. So let me say, let me go to Dr. Chaudhry.
We're waiting for the county.
We're waiting for guidance, exactly.
This is a really tough question. And, in fairness to the what seems like a pretty chaotic situation, it's very difficult to make these calls. I feel for our state folks to try to figure out who to vaccinate when. The older category, 75 and older, that was an easy one because that's where the highest mortality is. 65, pretty easy too, because that's a high mortality group. And then when you start to get into occupations, now it starts to get really murky and difficult. And then with these chronic medical conditions. So I don't have an answer for the chronic medical conditions thing. We have patients reaching out to their doctors and saying, hey, what can you supply me? Most of those patients don't have that short list of medical conditions that are reaching out, by the way. What we're going to try to do in Kaiser Permanente and what we've been doing is actively outreaching to our 75 and then 65-year-olds. We're going to try to do something similar where we'll actively outreach to folks that meet those medical conditions. How well that'll go, I don't know, but that's going to be what we're going to try to do come mid-March.
So Dr. Chaudhry, let me put you on the spot just a little bit more, if I may, which is to ask this. So if somebody showed up and said, yes, I made my appointment because I have one of these conditions, do you know what, quote, proof you're going to ask for at Kaiser Permanente that they have that condition?
I don't. For our KP members, it's easy. We can look up their medical chart. For non-KP members, we haven't worked that out yet.
All right. Dr. Smith, how about at the county?
Well, we're functioning pretty much in the same position as Kaiser Permanente. Obviously, if you go to your own system, your own doctor, They know what your illnesses are and they can adjust appropriately and make a decision. If you're going to a mass vaccination site or a site that's run by somebody else, they're going to have to be satisfied with different information. The county is anticipating an attestation process where you will sign under the penalty of perjury that you meet the criteria. We'll have the criteria listed on the attestation, and it'll also be listed when you make an appointment online so that you know what you're expected to attest to. But obviously the list is not exhaustive, it's limited. And so there will unquestionably be conditions that are higher risk but aren't on the list. And we're still working on how we're going to deal with that.
Dr. Smith, I think this is going to affect a lot of folks. So I'm going to ask Dr. Malur and Ms. Schilling if they have specific protocols in their organizations, but I'm going to come back to you and ask you a leading question in a minute. All right, so hang in there. Dr. Malur?
Sure. At El Camino Health, as Dr. Chowdhury was saying, it's for our own patients in our outpatient clinics, ambulatory clinics. We will actively reach out to those patients in those conditions. That's the easy part. The other part of attestation, we will follow the county guidance. If the county says that it's an honor system and the attestation is sufficient, we will follow that. And I know our El Camino folks have been in touch with the county multiple times a week and working through this. And we're looking forward to see how this will work. It's not going to be easy. And the hope is eventually by the next few months, there's going to be enough vaccine for everybody so that we don't have to do this, but we will follow the guidance.
Ms. Schilling, somebody who says, hey, I may be under 65, but I have one of the qualifying conditions. Any protocol at Stanford we should be aware of?
It's a great question. Our answer is pretty much the same as the others. First and foremost, we have been outreaching to our patients who qualify in each category and try to encourage them to get an appointment. So it will be the same in this case. If you're one of our patients and you happen to need a letter to go to a different provider to get a vaccine, we are preparing a standard letter for those particular patients. And third, if it's only attestation that's required by the county, that's what we will use to qualify people to sign up for an appointment with us.
Thank you. So, Dr. Smith, Ms. Schilling helps tee up my leading question for you, which is, it sounds to me like folks who are in that category of being under 65 but having a qualifying condition would be well advised to bring something, anything, but something that is an indicator of the fact that they have that qualifying condition. Ms. Schilling mentioned a letter from their doctor, if they could get one, even if it's a quote form letter, but anything that would indicate, so if a question comes up, they've got something to present, which would be better than nothing at all, even though the plan at the county for the time being is to use an attestation commitment, penalty of perjury, that they're good. Thoughts about bringing something?
Well, right now, for example, we require recipients to be residents of the county. So we look at your ID and see if you have a local address. So in the future, when there are other issues like medical conditions, having a letter or some evidence of the condition certainly will help. But that being said, we're not going to be in the medical police business where we're trying to take blood tests or prove that people have heart disease. If there's reasonable to believe that they fall into the category and they're willing to attest to the fact that they fall into the category, we're going to give them an immunization.
All right. We have a very direct question from Deb, and I'll ask Mr. Bloom to verify my answer. Deb wants to know, does food and ag include restaurant workers? I'm going to say the answer to that question is absolutely yes. Mr. Bloom, will you say out loud, yes, that's right, Supervisor?
Absolutely yes, Supervisor.
Thank you. Great answer. All right. It takes us to another questioner who just wants to confirm, if someone is not a Kaiser member, can the person still get vaccine from Kaiser? And again, I'm going to turn to Dr. Chaudhry, and I think he's going to say yes, of course, as we indicated earlier, Supervisor. Dr. Chaudhry?
Yes, of course.
Great.
That is the answer.
All right, good. Thank you very much. And now we've got a question from Ashwini, who says, can people above 50 but below 65 start enrolling now online on the websites provided here? And who would like to offer a comment about that?
No, they really can't, because at the time you make an appointment on our system, you have to be one of the individuals who meets the criteria. So you have to be over 65 or in 3 days come from one of those sectors.
Okay, and that last comment from Dr. Smith, Ashwini, was to suggest or remind us that folks who are qualified because, for example, they're a teacher or a person who works in the food industry, while the vaccine isn't available for them if they're under 65 until the 28th of February, signups have now started for those folks. But if you're just in that 50 to 65 age range and have no other qualifying condition, then regrettably, you're going to have to wait until some later date to sign up. Dr. Smith, did I recap that correctly?
Yes, that's correct.
All right, here's a great question. Does the workers in education category include students? Thanks, Ashwini.
In general, the answer to that question is it does not. The education and childcare is focused on educators and then the actual providers of childcare as well as staff. Now, it's, I suppose, possible that certain students might also be doing educating or childcare or otherwise match the criteria, but typically the education and childcare category is focused on, as I said, the educators, the childcare providers, and associated staff.
All right, we've got a number of questions about pre-existing medical conditions, which I think we have already answered. So let me go to Carl's question, which is this. He says, I got my first shot at Levi's Stadium and am scheduled for my second shot next week. Do they have the vaccine in hand or are they counting on further deliveries? Dr. Smith, I think that one goes to you.
We have vaccine in hand and we count on further deliveries as we schedule first visits. So we keep vaccine on hand for second visits, but we rely upon incoming for the first visits.
All right. And Dr. Smith, let me just clarify for Carl. We are advised by the state that we as a county and all of the various providers are not allowed to, quote, save vaccine for those second shots, really, that we can allocate second shots as soon as the new arrival of vaccine occurs, but we're not allowed to say we're going to set it aside. We're supposed to keep pushing out the vaccine as it arrives for first shots. Did I get that right?
Pretty much.
Okay, feel free to correct me, Dr. Smith. We want to make sure everybody gets the right answer.
Yeah, basically we get 2 shipments a week. One shipment is for first doses. The second shipment is for second doses that were for patients who got their first dose 3 weeks ago. So you're right, we don't keep it, but it's already spoken for before it gets here.
Got it. All right. Thank you for that. We got a question from someone who asks, I've heard there are some places that have a sign-up list or even a physical line for anyone that wants the vaccine, even if they're not in the eligible group, when there are extra doses at the end of the day, doses that would otherwise be wasted if not used. Is this true? And if so, where and how do we access? Who would like to respond to this question?
I can start. We do not offer vaccine to people who aren't in the eligible category. We do try to give vaccines. Basically, what we try to do is plan our day very well so there's no extra vaccine left over, number one. And then we have a list of people in the eligible tiers, like somebody else had mentioned, sort of an on-call list. But that's Showing up and waiting outside of our vaccine clinic will not get you vaccine at the end of the day.
Okay.
I will also same as El Camino.
Yeah.
We do not encourage, or give vaccines for people. We don't want people coming and standing in line at the end of the day. That's why we have that standby button link. But the standby appointments are also only for people in the eligible categories. I want to be very clear, and we don't want folks waiting outside.
I see Ms. Schilling leaning in as well. Please do.
Yeah, I've read those stories myself and heard those stories, and we're very consistent with our colleagues here. The only people who get vaccines from us, even if we're trying to do a no-waste strategy, are people who are eligible in those categories. Typically for us, they're the healthcare workers who are waiting for vaccine appointments, and they're local, they're nearby, and we'll call them and they're on call to come in and get vaccinated. But by no means, people who are not eligible will get vaccinated.
Okay. I've got a comment and then a question that are follow-ups essentially to some of the earlier conversation, which is just great. I've just got a comment from the one person who says, attestation is unacceptable. People will be lying all over the place. And I'll just let that go unless somebody wants to comment on it. Anybody want to comment on attestation? No. And the follow-up question, and I think it does bear sort of repeating and perhaps rephrasing. Just to be clear, someone wants to know: does this mean people under 65 cannot even attempt to sign up? So, and I think the question implicitly means people under 65 who don't have some other qualifying condition or who don't meet the criteria for this new expanded list. Does that mean that folks under 65 can't sign up at this point? Anybody on the call want to respond to that one?
Yeah, I'll start. I think that is correct. If you're under 65 and you're not in any of those categories coming up on February 28th and don't have any chronic medical conditions on that short list of medical conditions, we won't have an appointment set aside for that population. Yet. We will once vaccine is more plentiful.
Anybody else want to weigh in on this one?
And the same for El Camino if we just follow the county guidelines. So if they're under 65 and don't fall into any of the categories that are eligible, they can sign up at this point, as you said. Yeah.
And Dr. Smith, understanding that the third-party administrator will be in place, we expect mid-March, the county, which is currently responsible for distribution to most of the healthcare providers other than Kaiser and Sutter, has been told, as I recall, by the state of California that we either abide by these age guidelines, limitations, restrictions, or we risk losing our supply. Am I remembering that correctly?
Yes, there's quite a bit of risk, not only losing supply, but also penalties, fines, even criminal charges if they decide to. I doubt they would do that, but they're pretty serious about it. And if you're not in the qualifying category, you can't sign up and get the vaccine.
All right. And then we have a question from Nancy, who says that her Girl Scout troop was told that nurses could perhaps use some help collating paperwork, but that didn't turn out to work because of some permission issues, I gather. And then it says the girls want to know how they can help. Is there a way for Girl Scouts volunteers to help in this process at all?
Okay, I'll take a try at that. One of the things that, of course, the production process of giving vaccines is a highly, I think, rigorous process, so it may not be quite that, but I would love Dr. Smith to talk about. There's a lot of misinformation in the community, and learning about the value of getting vaccinated, the safety of vaccines, and why it matters to us as a community to get vaccinated. I think the Girl Scout troops is wonderful help for us to get the word out about that.
All right.
I would totally agree. I think that the best thing to do if you're a Girl Scout and you want to help is to make sure that everyone in your neighborhood knows what the rules are, and everybody who's qualified is getting a vaccine is signed up.
Yeah, I'll just tack on. I believe Girl Scout cookies are on sale right now because I have 3 boxes at home. If you put stickers, "Get vaccinated" on your Girl Scout cookies, that would be a great way too. A great campaign.
Always in marketing mode. Good to know. Thank you for those thoughts, folks. There is a question that was submitted prior to tonight's event. I'm going to use this as our final question, I think, because we're just about at time, and that is there a wait list process? And I know the answer is yes, because a couple of you have said so. But let me just go through each organization and quickly, if you can explain what your waitlist process is, if you have one. So I'll go literally through all 4 of the organizations who are represented here tonight. Dr. Chaudhry, I see you nodding your head from Kaiser Permanente. What's the answer there if somebody says, hey, is there a wait list, and what do they have to do to get on it?
Yeah, especially on our online portal, you can go in there and actually go through a series of questions, and it will tell you whether or not you're eligible right now. If you're eligible right now and we don't have an appointment yet available for that eligibility criteria, you can still complete that, and we keep that list, and we can actually outreach based on that list of interested people when their tier is up. So that's how we're handling it. If you call our phone system is not really geared to generate a wait list per se. It's more to schedule appointments for folks. But if you did want to get a wait list, I would say go into the Kaiser Permanente My Doctor Online or kp.org site, and you could, again, go through a series of questions, and it'll actually help you determine if you're eligible or not.
All right, let me go to folks at Stanford. Ms. Schilling, what can you tell us about how Stanford Healthcare might respond to the question about a waitlist process?
Yeah, I don't believe we use the My Health waitlist function because we certainly don't want people to anticipate getting vaccinated and making sure they call back. So what we do is we ask people to look frequently for new appointments when they become eligible. We do have a very small waitlist function for those unused vaccines at the end of a shift or a day. That's mostly healthcare workers who are nearby, and as I mentioned, we do outreach calls and so on. So that's really what we use today at Stanford.
Okay. Let's go to El Camino.
Thank you. So we do have a standby function, so you can book standby appointments, on the website. So there is actually a link for a standby appointment. So you click on it and it'll take you to the standby if there are any slots available. So when you click on that appointment and it's available, you can show up at that time. It's usually at the end of the day, and you commit to coming at that time. And then if there is vaccine available, you get the shot. We haven't wasted a single dose. If you don't get the vaccine at that time, then we will make sure that you get the vaccine in the next couple of days. Again, you have to be in the eligible categories, but we have a system set up so that there is a way to get on a wait list. And you go to our website, elcaminohealth.org, schedule vaccine. There's a specific link to book a standby appointment.
All right, and let's go to Dr. Smith for the final answer on this issue of a wait list or a standby process.
Currently, we do not have a wait list process. We're working on one. We have a little bit more complexity than some of the other providers because we have special populations that we're committed to serve: firefighters, police, emergency services, social workers, others that are always available to avoid wastage. So we have a wastage policy such that if there's a vaccine that has been thawed, it is taken either to another site immediately or to another group immediately or to one of the hospitals immediately and given to an eligible patient. But we are working on a wait list process. We just have to figure out a way to incorporate it so that we don't give people false hope that being on a wait list will mean that there will be a vaccine available rapidly. it's better for us to have a vaccine appointment.
All right. And Dr. Smith, I want to underscore my understanding, and again, please clarify or correct if need be, that one of the benefits of having been at this now for a little while is that we have a much better sense of what the no-show rate is and can therefore overbook slightly with great confidence that we'll be able to get to everybody who is booked, even though we may technically be overbooked because we know what the no-show rate is. Have I got all that right?
Correct.
All right. Thank you. Patricia, thanks. Patricia's pointing out that I somehow managed to pass by Margaret's question. I apologize. And thank you for the catch, Patricia. Margaret says, I had my first shot, but then they canceled my second one at the Palo Alto Medical Foundation. Margaret, we don't have anybody on the line tonight from the Palo Alto Medical Foundation. I'm going to guess that this is a function of the shortfall in vaccine that they had as a result of weather, because that significantly disrupted supply to some of the folks who are providers in our county. I do not know what their process is for second shots that have been canceled. But Margaret, I want to invite you to call my office, 408-299-5050, 408-299-5050. And if you ask somebody in my office to help you, tell them that I referred you tonight. We'll try and track it down so you don't get lost in the online world or in the telephone tree as you try and get that second shot squared away. And again, if you ever just get stuck, we aren't the healthcare provider, but we can often connect you with folks who can answer your questions. So thank you, Margaret, and thank you, Patricia, for noting that one got skipped. My apologies again. And then somebody, Deb, circled back to say, hey, meant to ask how you prove you're a food service worker. Does a pay stub help maybe? Dr. Smith, I'm going to ask if, again, this is going to be no documentation required because there will be the attestation under penalty of perjury. Is that the case?
That's correct. Go ahead.
And well, then let me just ask Dr. Chaudhry or Dr. Malur or Ms. Schilling, if someone was signing up by virtue of their status as a food service worker, and of course those folks are going to be arriving on your doorstep in 3 days, do they need documentation, or is their appointment going to be sufficient?
As of today, we are going to ask for some documentation. We haven't quite worked that out. We have about 3 days to do so. But honestly, if somebody comes and has, doesn't have their paperwork or doesn't have access to paperwork, maybe they work in agriculture and they really don't have access to that, we will take people on their word in those situations, most likely. Very hard to be in the business of vaccinating and policing at the same time.
All right.
I do appreciate the comment by the other constituent who said, people are going to lie. We're hoping that will be minimal. We're hoping by being open and honest in our system and how we're approaching this, that the vast, vast majority of people will be also similarly honest. We'll have to see.
Okay.
And I would echo what Dr. Chaudhry is saying. We don't require any documentation. We follow the county guidance about the attestation. We hope that people are honest and the honor system. And if guidance changes, we will follow that. But right now, we require the attestation, but not any proof of employment.
Okay.
Let me just follow that with a comment, if I could. That particularly some of these populations we're talking about now happen to be the highest need populations and may be the most hesitant or most unable to provide any proof of employment and so on. So it's a very challenging situation to be in, and we track with our colleagues here that we want to make sure that attestation is the proof. That's what the county has told us, and be as convenient as possible for people to get a vaccine who need it.
All right. Thank you all. And Nancy wanted to correct a misimpression. I had thought it was the Girl Scouts. Turns out it's the Boy Scout troop. but I think the answer still applies. And thank you, Nancy. I think regardless, what I heard from all these folks is that public awareness is going to be key in getting folks vaccinated, and that's a way that folks could help. And our very last question, and it's for the folks at Kaiser. It says, how would one be able to get on the wait list via the Kaiser website if they aren't a Kaiser member? Dr. Chaudhry, can you walk us through that? Is that a possibility?
Yeah, I would say that because we really so if you're a non-Kaiser member, you can actually go into our website and actually get a temporary Kaiser number. That'll come to you in about a day, and then all of a sudden now you can sort of go through that same system. But I'm not sure about that type of a wait list, honestly. Most of our non-members are calling our call center number, which is probably the easiest way to go. And our call center does not have a way to do a wait list.
All right. So the answer is can't guarantee, but please go to the website and see if you can get a temporary number, and that temporary number may allow you to get yourself on a wait list. All right, good. Folks, I do want to wrap it up there, and I know we'll probably get another question or two rolling in, but we are almost 15 minutes past the 1 hour time that we had set initially. So I just want to say thank you to all of you who participated in the call tonight, and from the community particularly. I want to say thanks to Mayor Darcy Paul for hosting us, and to the provider representatives, Dr. Smith from the county, Mr. Williams and Dr. Chaudhry from Kaiser, Ms. Schilling from Stanford Healthcare, Dr. Malure from Camino Health. And because we never thank the attorneys, I want to say thanks to Aaron Bloom for being here as well. And again, I want to close with this. Please, if you are in that 65 and up category and haven't made an appointment yet, I really am concerned that there's going to be a pretty substantial number of folks who are newly qualified, newly eligible. So get yourself signed up for an appointment as soon as you can, so you don't suddenly find that the system is clogged for an extended period of time. And remember, if nothing else, SCC Free Vax will get you to all of the providers and more who are on the call tonight. And it is the easiest sort of one-stop shop. Meanwhile, I'll just close with the exhortation. Please go out and find yourself a way to get the vaccine. The sooner we all make our way into and through the system, the sooner we can return to what we used to think of as a normal life. So thank you all. Be well. Take care. And immense thanks to all the providers. Good evening.
Thank you.